My name is Sammy Saab, and I'm a professor of medicine and surgery at the David Geffen School of Medicine. I've been a hepatologist for about 13 years here, and my focus is predominantly hepatitis C and liver diseases. Well, that's a problem. Hepatitis C is a silent disease. Most people don't have symptoms until it's too late. So hepatitis C can stay in someone's body for 2 or 3 decades. And it's little by little causing liver damage. And people may not realize they have liver disease until they come to the hospital with yellow eyes, swollen ankles, or a large belly full of water, or even a liver cancer for that reason. So for the most part, hepatitis is a very silent disease, and that's because your liver has a lot of reserve, and it can withstand those insults for many, many years. Baby boomers have a high rate of hepatitis C infection. We believe close to 70% of all hepatitis C are found in baby boomers. So as a result, the CDC now recommends that you're a baby boomer, you should be screened for hepatitis C. And the reason why is that many baby boomers are part of the golden child era and they may experiment with drugs even for a brief period of time. And back then, blood was not screened for hepatitis C infection. So many people may have been infected through blood transfusions or even surgeries or operations, as well as experimenting with illicit drugs. In the United States, it's a little controversial. The CDC believes about 2 million people are affected with hepatitis C. But we actually did a survey in our offices, and we reanalyzed the data. And we believe between 5 and 7 million Americans have hepatitis C. And across the globe, it could be as high as 200 million people have hepatitis C infection. In many countries like China, we believe 30 million people are infected with hepatitis C in China. And in Egypt, maybe 1 out of 5 people may have been infected as well. So for the past decade, the standard of care for therapy has been 2 medications. Interferon, a shot you take once a week, and ribavirin, pills you take twice a day. The success rate was around 45%. So about 45% of patients, they actually got cured of their viral infection. But it came at a cost. It came at a cost of adverse effects from interferon being fatigue, flu-like symptoms, weight loss. Ribavirin caused its own problems, including insomnia and anemia. So these drugs were associated with some adverse effects, and most people required 48 weeks of therapy, 1 year. So again, for the past decade, we've been using 2 drugs, interferon and ribavirin. These drugs did not attack the virus directly, but it did it indirectly. In May 2011, the FDA approved 2 new direct-acting agents against hepatitis C. And the advantage was they could directly target the virus and inhibit viral replication, stop the virus from replicating. These drugs were met with a lot of enthusiasm, a lot of excitement. Many major unmet needs were addressed. Duration of therapy was shorter, you had higher cure rates, and many populations that were now well served with interferon and ribavirin were now being cured with these new hepatitis C combinations. The problem is all these successes came at a cost. And the adverse effects, the side effects of medications got significantly worse. So the new regimen had been 2 drugs, but in May 2011, it became 3 drugs, interferon and ribavirin, plus either Victrellis or Insevic. And that was associated with some improvement in cure rates, but more significant adverse effects. So when these drugs are first launched, we have many patients and their providers are eagerly waiting to start this medication. And when these drugs were first able to be approved, there was a huge enthusiasm. Many people started therapy. But over time, as patients continue on the therapy of Insevic or Victrellis, plus interferon ribavirin, we started to see many more side effects. Many patients became severely anemic, and several actually required hospitalizations for transfusions. We also learned that one of these medications was associated with a severe skin rash. So many of patients had to stop therapy because of adverse effects. To make a long story short, over time, the enthusiasm for these medications decreased significantly. So much so that for the past several months, very few doctors are treating hepatitis C with these agents.